Hello everyone, welcome to The Voice of Nursing. My name is Adrian Tracy, the CEO of ICG Medical. Today we are joined by Kelley Johnson, Chief Nurse Advocate and former ICU nurse. Kelley, welcome to The Voice of Nursing.
Thank you for having me. I'm excited to be on.
Kelley, tell us a little bit about your background and how you got into nursing.
Okay, cool. So I graduated in 2015 from nursing school at Grandview University. I passed NCLEX, so I guess that's about 3 years ago. I became a registered nurse. And the first job I ever had was in the cardiothoracic surgical ICU. I did some stuff in emergency, and then I went also to an adult ICU. And then I did a little bit of a career move with pageantry, so everything kind of changed for me. But I got into nursing through kind of a personal experience. My father passed away when I was really little from colon cancer, and we just had excellent nursing care, and I just really wanted to do that for another family. And yeah, so that's me. So then, like you said, right now I moved out to Los Angeles and I am the chief nurse advocate for Wanderly, and that's what I do now. So I still work with nursing all the time. I'm still in school, actually getting my doctorate in nursing, but I'm just not bedside.
Very good. What was the specialist area you mentioned that you went into? Cardio?
I did cardiothoracic surgical ICU, and I did some emergency, but it was more of a kind of an internship, almost volunteer position, because I was Miss Colorado at the time.
Tough break. Tell us a little bit about that area of speciality, why you went into that.
Yeah.
Because obviously that's a different term possibly than we see maybe in the UK.
Yeah, absolutely. I went in honestly because I had an incredible preceptorship my senior year of nursing school. So I had one of their CTS ICU nurses who kind of showed me the ropes of ICU. And then honestly, to be offered an ICU position as a new graduate is that just doesn't happen very often. And I was
so really, it's a bit different route.
Yeah, and I was really honored to be even considered for that. So once they offered it to me, it was just kind of like a no-brainer. But I was only there for a couple months actually before I moved to Colorado. But just a really cool, a lot of open heart, a lot of patients that are pretty complex, and it just kept me on my toes, which I liked.
And what's your new role or the role of this chief nurse advocate? Tell us a little bit about a bit of that.
For sure. So what I do for Wanderly is, we're a travel nursing technology company. So I'm not sure how much travel nursing goes on in the UK, but here, anytime there's any sort of crisis mode, so flu season where you're just getting a ton of patients in hospitals, they usually want to hire travel nurses who can go into hospitals or different facilities for about 13 weeks, and then they can go somewhere else. So they come in just to pretty much help pick up any extra slack that's needed, kind of keep the team moving, and then they can go to somewhere else. So we are a technology company that basically you can go onto our website and find a whole different bunch of jobs that you could possibly want from various agencies, and you can compare them right on our site, and then you can pick which one you want and submit with one universal application, so you don't have to constantly be uploading your documentation for every different job that you want every 13 weeks. So we try to simplify the process pretty much. But as the chief nurse advocate, I work with all of our travelers and I handle a ton of our marketing content. So it's really fun. I love what I do. And it still is very much hands-on nursing, even though I'm not bedside. I do a ton of blog writing. I do a ton of visiting hospitals, working with a bunch of different leadership members in hospitals, and then definitely working with all of our nurses and making sure they're taken care of. So I love it.
Very good. Well, I suppose sort of leading on to that, what's the nursing market like in the US at the moment? What sort of challenges are nurses facing?
Oh gosh. Well, I think the biggest one is probably just the changes kind of overall in healthcare. When the Affordable Care Act was passed, when President Obama was in the administration, it kind of it gave so many people health insurance, which is incredible. We're all for preventative health and those sorts of things, but it really basically gave a lot more patients to the healthcare system than there were providers. So there's just been kind of an adjustment, seeing a lot more people. It's a lot more quickly paced, I guess you could say, of a work day. I think nurses are definitely facing, kind of some negative stuff too, bullying, harassment. There's a lot going on right now in trying to, I guess, change legislation to make nurses safer, especially even just with patients. I mean, just the abuse that they kind of are enduring. But there's also a lot of really cool things happening for nurses as well. So I don't know. I mean, I guess that's pretty much it. What I've seen, that there's a lot of changes that are occurring. It just keeps getting more and more advanced, with technology and with autonomy, and things are just constantly improving and they're constantly getting more technical. And so we have to be constantly adjusting.
And have you seen the role of the nurse changing? Because we've noticed very much in the UK, we're having surgical nurses now here as well performing operations.
Right.
The role of the nurse, because obviously the cost of doctors versus the cost of nurses, but the education of nurses and so on and so forth. The role of the nurse seems to be evolving in the UK, and we've seen some of that in the US as well.
Yeah, absolutely. I think the role of the nurse has just become more autonomous. I mean, we have so much more responsibility that we can have independently. I think a lot more nurses are going after their BSN, so they're getting higher education, and then a lot more, even from there, going on to get their NP or their DMP. It's not necessarily a requirement, but I think it's just nursing is changing. It's becoming more advanced. Legislation is allowing nurses with higher education to have more autonomy, to have a larger, wider scope of practice. And so I think that's a big hard hitter for nurses. Is that we want that respect. We want that leadership role on the team. We want to be, in leadership positions in the team. And so I think it's really changed the mindset of the nurse. We're not an assistant, we are now leaders. And I think that that's something that I've seen over the last 3 years, even more so than when I was in nursing school or wanted to be a nurse. I mean, nurse practitioners especially are really fighting to just have more responsibilities and to be able to take more control over their patients.
I think the care aspect from nurses is very evident. I know we've had some doctors like Dr. Ram, who was our first interview in the US. He was saying that the nurses and the care they give the actual patients really helps the physicians. Mm-hmm. So they're actually learning from the nurses, and they're learning more, they were saying, from the care aspect of actually looking after the patient.
Sure, that makes a ton of sense. I mean, I think nursing in America especially, but probably most places I would hope, is just so compassionate. I mean, you can't really be a nurse without that caring foundation. You kind of have to know how to have great bedside manner. You have to be compassionate in moments where you just want to scream. I mean, I think that's kind of what we're taught from day one. My first year of nursing school, I actually had a class called Caring, and it was just this course about kind of just the art of nursing and kind of how you have to blend the science of what you know and your intelligence with the art, the art of just caring for total strangers for the rest of your life. I mean, that's our profession, is taking care of people in their most vulnerable moments, but with this just magic, this compassion and this love for these people you don't even know. So I definitely, that's right. And what's funny too, is I think nurses have also kind of gained a newfound trust also from physicians and from providers. And I think that can only be good. They're trusting nurses more. I think they're learning from them as well, because a lot of our veteran nurses have been doing nursing on the same unit or within the same specialty or even the subdivision of the same specialty. We're talking for like decades. And so if you have a brand new physician that comes on, and maybe it's a resident, or maybe it's a physician that's, brand new, but I mean, there's a lot to learn from a nurse who's seen, that same type of patient then for so long. So I'm glad to hear that. That's good. I agree with that.
So there's just more opportunity, isn't there? I suppose they talk about, the nurses and the care they provide. And they tend to spend a bit more time with the patient.
Mm-hmm. Absolutely. It's
so
all
they can see the changes.
Yeah. I mean, when the ICU, we had 2 patients and for 12-hour shifts. So you spend 12 hours with 2 people. And if they're there for a couple of days, you might see them the majority of your day for 3 days straight. And so, you just learn a lot about people, and you learn a lot about their families and what they want, what they need, and their fears. And you do get close to people. So then when a physician or an NP or a PA walks into the room and is doing rounds or wanting to know your, perspective on the patient's situation, there's nobody better to tell it than the nurse. And I think that they can learn a lot from that, and then they can make, medical and clinical decisions for treatment based off of what the nurse says. So it's definitely a team. For sure. Yeah,
no. I think the big thing as well, how I don't know whether nurses learn these, but the people skills of working with the families. Mm-hmm. That's kind of quite a big aspect of when the families want something different, or the communication. I was talking with the nurses we spoke to, like, how do you learn that? They're just gonna go, well, you kind of pick it up, and you're like, oh.
Yeah, you do, and it's in school. It's so funny you mentioned that. I'm in school right now, and 2 of my classes are advanced assessment and advanced psychiatric, and we have to do courses that are literally just communication techniques for little kids or for adult patients or mental health patients. And really, it's just it's teaching you how to communicate, because you have to find things out that most normal people wouldn't just ask you on the street. And so, it is a skill. And I don't think every single nurse is fantastic at those skills or horrible at them. I think you do kind of pick them up as you go, depending on what specialty you're in, but it's an art. I really think that the communication that you have to be a nurse is an art.
Right, I definitely agree. The listening, I think, is the big thing, and interpreting what they're going to be saying and how they're saying it and so on.
Yeah.
One thing we talk about in the UK, and I think it's evident, the pressure nurses are under at the moment.
Oh, sure.
Seems to be, you seem to be infallible sometimes in the healthcare industry, and we talk a lot about the mental health of nurses.
Yeah.
Is there much talk about that in the US?
Oh, definitely. I think when you said the pressure, that just strikes so many chords in the nursing profession. It's so true. I think we're working on it. I think that nurses, especially in different coalitions or different, associations, are really pushing legislation for safer staffing ratios. And there have been some states that have adopted some, and there are definitely still, legal and legislation that's occurring right now that is working for safe staffing ratios as well. But I think nurse burnout, we hear that word a lot, and I think that comes from nurses feeling pressure on their license, feeling pressure every day. And it just comes from having a lot of people to take care of, and then you feel like you're spreading your license too thin, or possibly even being unsafe, because you have all of these people you're trying to take care of in a short amount of time. And if an emergency happens or something you really need to get done has to be put off, it just creates a huge stress. And I think with the nursing shortage in America, especially, we have over 300,000 male nurses, which is really great. That's hopefully more males want to join the profession. But with the staffing shortage in general, we just don't have enough people to take care of as many people that are getting sick. And so the pressure is wild for sure. But I just hope it doesn't continue, because I don't want it to lead to nurse burnout. And I think that it possibly could, because it's really tough to go in and you have to spend all this time taking care of someone and being compassionate, and, especially in a stressful environment. While on top of that, having people telling you have, 7 other people you have to take care of in that same way as well. And that person might need more of your attention. So yeah, spread thin pressure is definitely something that we see. I don't think it's every single nurse that experiences it, but the ones that do, I think, just are concerned for their license. They're concerned for their safety. And we have to do something about that.
I was going to say, what sort of support out there is for nurses in order to help them if they're having these challenges? Are there people they can talk to? Is there financial support? Or, what sort of options are there in the community to support and just give them a chance to even say that they're having problems?
Sure. So I think there's a lot of community support just within the hospital facility. There's a ton of different resources nurses can use, whether it's counseling, or if they're religious and they want to go visit the pastor or whoever might be on, the clergy on the facility campus that day. There's a ton of different initiatives that they do for self-care. So a lot of self-care is just discussed constantly in the nursing profession. It's getting a massage, going for a walk, taking a break. It's funny. I think a lot of management has seen kind of what's happening with nursing, especially on units where burnout and just kind of pressure and stress is really high. I think managers are doing a really good job of trying to recognize that and making sure nurses take their breaks, or at least trying to, give them some time off or time to step away, especially when, really sad things or really intense things happen for nurses. So I think a lot of the support's really in the hospital or the facility setting. But then you also have nurses that maybe do clinic work or maybe do home health. So then that kind of puts the responsibility on the nurse themselves to kind of recognize if anything like that is happening and to seek help. But it happens so often that it's not really always like a go to therapy is the response. It's just kind of like, sometimes you just need a break. Sometimes it's like you need a vacation or just taking some time to just do anything that you really enjoy, yoga, running, whatever it is. But nurses have to be really careful of that because of the staffing shortage that we have right now. We can't keep losing nurses we want, and we need more in this profession. And so it's kind of on us to also take care of ourselves.
Yeah, I think the nurses are the worst for, actually looking after themselves.
Mm-hmm.
They've got the great care and vocation looking after everyone else, but sometimes they don't worry about actually looking after themselves, or, they need someone, one of their peers to go, "You okay?"
Yeah, absolutely. Well, and sometimes they can't take care of themselves because they might not even be recognizing that it's happening. I think that's how much nurses are working constantly. And so, I think sometimes it's like they're so burnt out, they're so stressed, or they're so overwhelmed, and they don't even notice it because it's almost like their new normal. And that's the part we need to change.
Yeah, I think that they also have that, obviously the nursing profession held in such a high esteem that, they can't feel that they'll make mistakes like any other human being.
Right.
And the reality is the more tired they get, as you say, safe staffing levels, the more chance they're ever making a mistake, because they just, they're going to, no one's perfect, unfortunately.
Right.
And I think, the number of times I see the memes or whatever on social media about not having a break, not eating anything, not having a chance to go to the toilet for 12, 15 hours, whatever it is.
Yeah, that's exactly right. I see those all the time too. And that's exactly what happens. I even remember just being a nursing student on a preceptorship where I had a second nurse to help me. I remember being like, oh my gosh, it's 4 p.m. and I haven't had lunch. You know, you get there at 7 a.m. and I hadn't eaten. That's just the life. We just have too much to do and not enough people to do it. But I think I do think that we're hopefully at least moving in that direction, but you can't force people to want to become nurses. And so I think a lot of what we can do as nurses too is outreach, you know, speaking to our high school students or our college students about why they should go into nursing, all the pros of nursing, because there is a lot of misconception, I think, and also stigma about our profession. And I think there's just a lack of education about what we do. And I think it's on us to help fix that. You know, we can talk about our profession and explain what we do and explain what nursing really is. And hopefully, you know, encourage people to join us just by telling them, you know, the actual truth about what it is that we do.
Mm-hmm. I suppose in nursing as well, it's very vocational, but there's still the element of, you know, marrying that up with the cost of going to nursing school.
Yeah.
You know, do you see much of that, you know, coming out, you know, nursing wages and then trying to balance up the debt of college as well?
Sure. I mean, I think a lot of scholarship opportunities are available. There's a lot of just very specific nursing scholarships, and that could be education too, you know, just teaching people about the scholarship and grant opportunities for them, especially with male nurses. There's a lot of opportunity in that. There's just a lot of opportunity for scholarship. But yeah, do I think that the cost of nursing school is a deterrent? Definitely. Do I wish it was different? Of course. But I mean, yeah, I do. I do think that is a big part of it. I also think it's just kind of a leap. You know, there's nothing to compare nursing to. You know, you can't, I feel like when you're in high school, maybe you can work at a restaurant and then maybe you learn you want to become a chef, or you can, you know, something like that. In nursing, there's really not much that can prepare you. You can become a CNA, and that's great and fantastic, but it's just not the same. And so I think that's part of people not wanting to necessarily become a nurse or possibly going to school, is that they don't have any idea what to expect. I mean, you just think you're taking care of people, but it's so multifaceted that until you're really in it, it's tough to know if that's what you really want. But that's on us. We can educate people on what we really do.
Do they do any work experience programs or anything like that they can, you know, give you a bit of a taste of what it's going to be like?
No, I mean, I definitely didn't. I was a CNA, and that's a nursing assistant, and I loved it. I loved being a CNA. I think it gave me a really good foundation for caring about our CNAs and appreciating what they do and respecting them, because they work very hard. But I've never seen any sort of like internship or follow a nurse for a day or anything like that. And I think that's something that we could maybe improve on.
And obviously the working environment now with nurses, especially, you know, in the UK, we have an aging population, much like the US, and we also have a nursing population in our nursing community. Mm-hmm. Do you see some of the challenges around having a millennial all the way through to the baby boomers in a working community in the hospital? Have you seen any sort of different challenges or strategies with that team?
Yeah, of course. I think the one thing that any new graduate or nurse that's worked less than 5 years can do to just always improve is to utilize their veteran nurses constantly, because our veteran nurses, the older generation of nurse, has so much knowledge and so much wisdom and experience to offer to us and to help us. And I think that's important, that we're always a team with them and constantly asking them ways that we can improve and things that we could possibly do better, or what's the way that you did it. You know, I want to learn from you kind of conversations, because they are so smart and they've done it for so long. And in that same breath, I also say that our veteran nurses have had not difficulties, but I think have faced more challenges with all of the new technology. You know, we're switching over to a bunch of different universal kind of electronic charting, electronic recording. And I know many nurses, who have always just handwritten down everything about their patients. And in the last 5-7 years, it's been the huge switch over to electronic recording has been
all iPads now, isn't it?
Yeah, and it's been fantastic for patient recording. It's been fantastic for safety. It's been for competence, for making sure nurses don't miss anything. I think it's been a great shift. But you know, if you're someone who it's like cell phones came out in the 50s or when you were in your 50s, that might be a little bit more difficult now to all of a sudden be operating computer technology as well. So I think those changes are things that people encounter, but it's not impossible. So, yeah.
Yeah, technology versus experience, I suppose.
Yeah, absolutely. And I you know, you see those challenges, and I think that's also kind of with every profession. I mean, that's just kind of what we've gone through, I guess.
Yeah, it's the different ways and different opportunities, I suppose, as well.
Yeah.
We're talking of people looking at nursing as a career, because some people take nursing on as a second career. Are there, you know, have you got 3 points to maybe look out for? 3, as you say, pros of moving into a nursing career in the US?
Oh gosh, I can think of so many. So
I'm sure we've only got an hour, but
I know.
great.
I just love nursing so much, and I think it's so great. But I think what people need to know, if there's 3 things that they need to know, the first one would be you're not somebody's assistant. When you're a nurse, you're not bossed around all day. You're not an assistant, and you're not just in a hospital getting people coffee, handing pens, and taking vitals. Nursing is incredibly critical. Nursing is so important, and nurses are highly educated healthcare professionals, and they're essential to safe and effective patient care. So it's not just kind of showing up and just doing just the grunt work, and then I don't know, it's just not. I just think that a lot of people think it might just be being a patient's go-to person, where you can just go get them food, or take their vitals, or go get them some Tylenol. And it's so much more critical than that. It's so multifaceted, and I would want anyone who's considering going into the nursing field to know that it is a challenge. It is constantly changing. You can do so many different pathways of nursing. There's so many different categories you can have in nursing, so many different units you can work on. It's constantly changing. There's varying degrees of education that you can have to have different types of autonomy and different scopes of practice. There's just so many different things. But I think the most common misconception that people may not go into nursing believing, because they believe it, is just that we're somebody's assistant, that we're just kind of we get people food or beverages or whatever. And I want them to know that that has nothing. Yeah, I mean, sometimes that's just being nice, that's just being helpful, but it has nothing to do with that. Our medical science degree and what we're able to do, and really how we're able to save lives by using our knowledge and our, all of our training to actually to truly see what's going on with a patient and make recommendations based off of that, and make independent decisions on their care based on what we know. And I think that those things are sometimes forgotten, or maybe not even ever known. I think if you're not in the medical field, or you haven't had a nurse or needed a nurse, it's tough to know exactly what we do. I think that has to do with a lot of the stigma out there too in the media. That doesn't really help. When you see the nurse Halloween costume, or the nurse and the doctor dating on the television show, that doesn't really help us out, because that's not at all the truth. And it's just kind of crazy how we've let that kind of go on for so long. We've let that kind of honestly blemish on the profession continue, and we are the only ones that can change that.
And number 2, what was the second bit of advice?
Oh man, if you want to go into nursing, well, it's incredibly rewarding. That's what I would say for sure. It's incredibly rewarding. I can't remember one day at the hospital where I left where I didn't feel like I at least made a small difference. And I don't know if you can say that about every profession. You will make a difference every day that you're a nurse. And I think the third reason to go into nursing is that it will never be the same ever. It will always be changing, and you can pick so many different routes of nursing. So say you want to help deliver babies and you go into L&D. You can go into L&D for a couple years, and then maybe you're like, man, I really want to do heart stuff. So you go into cardiac, or you go into telemetry, and then maybe you want to spend some more time with your kids. So you become a school nurse, and then maybe it's, man, I just can't stay in this one place. I'm stir crazy. And then you want to become a traveler. There's so many different things that you can do, which again, I don't think you can say that about every profession. And you will always have a job. I know that's the really common one everyone knows, but you will always have a job in nursing. Someone will need you somewhere. And that's kind of a really nice thing too. Somebody will always need you.
There's always plenty of demand, isn't there?
Yeah, there's no problem with that. That's for sure.
And I know you can't look into a crystal ball, but what do you sort of see the future looking like for nurses in the US?
Oh, well,
the next 5-10 years.
Yeah, it's just tough to say, because I'm hoping, and I'm seeing a lot of statistics that the shortage is only going to get worse, which makes me really nervous, because I don't know how we're going to. I don't know how we're going to recover from being so spread thin. I just don't know what they're going to do. So I'm interested to see how that plays out, whether they have to make budget changes to pay nurses more, to incentivize nurses. I don't know if school is going to become cheaper. But what I do know is that technology is just going to continue to improve and continue to help us out and assist us in our jobs, which hopefully will then cover some of that gap from the shortage. But even now, we have technology that can do surgery by itself, so I think that will just constantly be improving and helping. I think we're only going to have to, everything's just going to get more advanced. I think we're going to not only continue electronic charting, but who knows what kind of technology they're going to come out with to make our job easier. I don't know. I'm just excited to see kind of where healthcare goes, especially insurance-wise with patient care. And I'm very interested to see if they're going to keep, or at least keep trying to obtain universal healthcare and trying to continue to have everybody allowed to have health insurance, and that kind of stuff really it trickles down like crazy. So I am really curious to see that, but I definitely think that no matter what, nursing will continue to push and claw and fight for autonomy and more leadership positions, because we're not going anywhere. And I think that we're really done being disrespected in the medical community, and we're really starting to really stand up for ourselves when it comes to legislation and responsibility in our roles and just respect in general. And yeah, it's going to be good. I'm excited. Nurses are really fighting right now, and I think it's really great, and it's backed up by evidence. So I'm excited to see kind of what happens. But you're right. I can't tell the future, but just looking at the last 10 years, I mean, we're in for a wild ride.
Yeah, I was going to say lots of chief nursing officers and things like that on boards now. You're seeing a lot more of that than there was ever before, which is which is always nice to see. That's a trend in the UK as well. So it's nice to see nurses being respected, as you say, more across the world. Yeah,
I agree. And I've actually never said this publicly, but one of the things I really want to do as a doctor of nursing in a couple years is fight to get on a medical television show. You know, we have physicians of all types, we have doctors of all types of medicine, but we don't have one of nursing that's actually fighting for that kind of education for the public. And I want to be that. So that would be really fun to pursue in the future. But yeah, it's on us. That's the thing I always stress when I do speaking engagements. It's on the nurses to fix this. We can't just say, oh, poor me. You know, they don't take me seriously in the hospital. We have to fix that. We have to prove it with our actions, our behaviors, and with our words that we deserve that kind of respect. And that's okay. We have what it takes to prove that, but it's on us to do so.
Yeah, well, I'm sure there's plenty of people fighting for the same cause, which is nice to hear.
Yeah, it's awesome.
So apart from nursing, what are you doing outside of nursing then, Kelley? We always ask what people do and their hobbies and things like that as well, when they've got a bit of time.
I'm a sucker.
Nurses are very busy people, we find.
Yes, very busy. I have a little bit more flexibility in my schedule, but I am Miss California, so I do my stuff with my pageants. And I have a bulldog.
What does that consist of? I've never met Miss California before, I'm afraid.
Yeah, it's awesome. It's a volunteer position, so I think people sometimes forget that. But it's a lot of public speaking, a lot of visiting schools, hospitals, charity events, fundraisers, and you're there to hopefully draw in more people to attend, so you can raise more money for the cause or whatever it may be. But it's also just really special. I get to do a lot of really, really special things with kids and incredible people in our community, and raise money for things I really care about, and for other causes that other people really care about. And that's really rewarding as well. But that's pretty much what it is. And then, we also hold the pageant every year. So it's fun preparing for that. That's a ton of fun. But yeah, my hobbies are pretty much just being by the beach and eating a lot of good food. I grew up in Colorado and I live in Los Angeles now, there's so many wonderful restaurants to try. So that's really fun. And working and just kind of seeing what's next. I'm in school, so I definitely have to focus on that. But yeah, just kind of living this awesome California life. And then once I'm done with Miss California, we'll see what happens.
Very good. And where can the guys find you if they want to follow you on Twitter or Instagram or whatever your social handles are? Yeah,
all my social handles are at Real Nurse Kelley with an EY for Kelley. Everyone always asks how to spell that. But if you start typing in Real Nurse Kell, it usually pops up. But that's where you can find me. And you can find Wanderly if you are a traveler. If there are any traveler nurses listening, it's just wanderly.us. Easy.
Superb. Kelley, thank you so much for your time. And thank you to all our nurses and our carers and our physicians out there for looking after us. Thank you for watching The Voice of Nursing, and we'll catch up with you again soon.
Awesome. Thanks for having me.